At the top tonight, the split of the city-county health district. It was one of the many items on today's city council agenda where leaders provided an update on where things stand right now in that transition.
Our Julissa Garza has been following this story since the beginning and joins us in studio now to share some of those answers in tonight's top story.
Leslie, Rudy, City Manager Peter Zanoni saying today at council that they are using a 10-step plan to evaluate programs that the current health district has and making sure employees are involved and any lingering questions they may have get answered.
The city of Corpus Christi moving forward with their soon-to-be city health department.
But it's not just so we can take what we have and copy and paste it, but rather how can we innovate? How can we do something different if we need to? How can we bring in those best practices into the new department? And so we're doing that. City Manager Peter Zanoni says they're implementing focus groups for employees to be part of. To help give us even more input, things like the building and asset management, how can we better improve those? Zanoni says employees are feeling more at ease with these focus groups and weekly meetings. And when it comes to the positions in the department, they're working their way from the top, making sure manager roles are filled. We posted the five managerial positions for about a 2-week period. They closed last Friday. So some of these major program heads will be selected soon. The postings were all for internal personnel only. So the employees that are working today were the only ones that were eligible to apply for those managerial positions. Once those positions are filled, Zanoni says they will advertise for the positions within the programs and make sure managers are involved in the hiring process. But they're also looking at pay increases. One negative effect of the district is that neither side have adjusted pay ranges because we couldn't agree on what the range could be. So these employees are really below market pay, and every one of them will probably have a pay range adjustment because of that phenomenon that exists in this dated model. And when it comes to the highest position, health director, a recruiter is helping the city. He's creating the job specification now, and soon we'll be advertising locally, state, and nationally for that position.
Zanoni adds that the city has 10 grants with 24 grant-funded positions, and that is going to take a little bit more time, but they are already working on it. Leslie, Rudy.